So I will hand over to our next speaker, James Lang. Maybe you can set up the slides. Pascal has already introduced James, so I'll let you, if you want to say anything more about yourself. As we continue, don't touch that. Yes, there we go. So James is going to be talking to us about gender-based violence.
All right. So, hello everyone, and thank you so much to UN University, Michelle, Pascal, for welcoming me today. I'm very happy to be here and talking about reimagining prevention of violence against women and girls. So, why does violence against women and girls, gender-based violence, persist? Why do 1 in 3 women around the world still experience violence at the hands of men? Does anyone want to take a stab at this question?
Patriarchy.
Yes.
Lack of exposure, lack of education.
Okay. I admit this is not, yes sir.
Yeah, and all those feudal lords and petrarchs, supported by the political and military governments. Goes on.
Okay, I think I'm going to touch on a few of those responses. I do admit this is not a fair question. It's a very complicated and multi-dimensional problem that changes across the world. There are trends that we will talk about, but there is no one simple answer to this question. I'm going to present the issue of violence against women and prevention from the perspective of the international development or the aid industry and how it's been framed and why or what priorities we see internationally. I worked for a long time within the UN system and for international NGOs on violence against women. And my presentation will look at 3 different sections. I'll start with the positive, so what's been gained recently and what are some of the strengths in the prevention field, and what are some of the challenges and some of the reasons behind this question, and then talk about some ways forward. So this is not just my own musings. This paper is actually something that I worked on with a group that started a new international NGO called the Prevention Collaborative. So we did an analysis before we established this NGO of what was working and what were some of the problems with the field of working on primary prevention of violence against women, as well as looking at response systems and how governments and the international aid industry is dealing with it. So I understand that not all prevention falls under this chapeau of international work. There is a link to this paper, the strategy paper of the Prevention Collaborative, which is here when you receive the slides. The link is there. So starting with the positive, I think that the work on violence against women and girls has been sort of a thing in public policy and has been in the discourse of international aid really since the 1980s. Of course, it's always been with us, but as a priority or as a topic, there's been about 30, 40 years worth of work. And over this course of events, one of the more recent successes that we could look at is within the policy realm. So if you look across Asia Pacific, most of the countries now do have national action plans on ending violence against women and girls. There are other kinds of public policies that have been put in place, and this is really in the last 10 or 15 years. And I think most importantly, from the international perspective, as you can see up on the poster there, the Sustainable Development Goal number 5, which is around gender equality, for the first time includes violence against women as a component of gender equality. And so that obligates member states of the UN to measure progress as part of their progress on the Sustainable Development Goal. So that's, I think, quite an accomplishment, and it is fairly new to make these connections between ending violence against women and progress on sustainable development overall. There's also a growing body of experience. This field has expanded. In my experience, I'm also privileged to work for another NGO called the Sexual Violence Research Initiative, which it serves to convene researchers and policymakers, and it holds a conference every 2 years, which is a research-driven conference, and I've been part of that for about 8 years. So the 4th conference coming up in 2 weeks, and it's grown from a few hundred, maybe 200 or 300 people in the first one, to 700 participants in this upcoming one, and thousands of submissions of research on violence against women. So, and this is from every region in the world and from all countries. There are researchers and there's academic and practice work going on to complement the policy frameworks that we've seen progress around. And when we boil down what's happened with the research and with the practice that's been ongoing, the most positive thing to say is that there is evidence that violence is preventable, and there are instances where violence is reduced within specific sites, within communities, and that's been demonstrated. Along with this evidence, there's a spectrum of intervention models that show promise or effectiveness. There's been a significant amount of money put into research, evaluation research. So most notably, the UK government has been funding a global project called What Works on ending violence against women, and they funded 10 RCTs, randomized control trials, and they have an innovation side where they're trying to look at interventions or initiatives that aren't ready for a randomized control trial, but might have promise. And so this significant investment has shown, along with many others, that there are both demonstratable actions that can be taken to change the drivers, including social norms and gender norms, and specifically in a specific site over a specific duration. But I think going back to my original question, why haven't we seen movement on the global prevalence rates? Has more to do with scale and priority, and some of the things we'll talk about a little bit now. So the analysis that we did to understand where the field was and where the problems were, I think is germane to global public health and to the international development aid industry more generally. So I do think there's a lot to take away from this. It's not just about violence prevention, but what we did was looked at violence prevention within the overall politics of international aid, and what some of the structural biases within aid that in turn affects how violence against women is funded and practiced. We also looked at the field itself, where practitioners don't agree on everything, and there are sort of hot button issues that are germane within the field itself. So, for example, the role of men in ending violence against women and how much money should be spent on engaging with men is quite contentious for lots of women's groups who feel like money should be going to survivors of violence and not to either perpetrators or to men who are trying to work as allies with women. Sex work, issues around LBGT and the work around sexual violence and conflict. They all have contestations and tensions that are part of the field themselves. Also, I think that the research, like more public health driven research on violence, isn't always gendered. And so you have things around connections between alcohol and drug consumptions and prevalence of violence, which doesn't have this. It doesn't fit nicely into a gendered analysis. So those are the internal issues that we looked at, and then of course the technical, which really are just about the projects and programming, the dynamics of setting up interventions. And this sort of environment, of course, is influenced by external shocks. And I think in our last presentation we got into, does conservatism, what's happening geopolitically, external shocks, and include the rise of nationalism, global warming and climate crisis, which drives people to migrate and affects livelihoods, and those have severe impacts on violence against women, put women and girls at risk. Other external shocks, it also include the financing, which I think we talked about in the last, the ebbs and flows and the inconsistencies in that. So this was our conceptual framework for understanding the problems in the field. And I'll concentrate a little bit on the structural and the technical. And again, I do think these are more, the structural issues are much more about the politics of international development and aid and are germane to other topics beyond violence against women and girls. So we identified a few different structural biases which do affect what programs look like. And the first one is quite important, the knowledge, how we frame and understand knowledge and the biases within the field. And we sort of identified the global over the local, the valuing of northern academic-based knowledge over practice-based experiential knowledge of practitioners, the quantitative over the qualitative, empirical versus experiential or experimental or theory-driven. So this bias in knowledge, or these biases in knowledge, end up defining what we mean by violence against women. They end up defining what we mean by evidence and what works, and it kind of puts it in a limited frame, which is a frame again not only by Western academic thought, but by English as the global technical language. So it leaves out what might be happening throughout the world in outside of that limited frame. Related to that, and the knowledge bias, which kind of drives the framing of the problem and the framing of the solution, is what how we build capacity and what we value in terms of learning models. And within the international aid industry, very technical approaches to learning are predominate and are valued over empowerment-based or Freirean community and peer-to-peer learning models. So just a global expert coming in and just like I'm doing now, I'm the white guy coming to drop knowledge on the room, and that sort of model has been the mainstay of international development for many years, where there's some technical expertise that is valued, and it's given in a very top-down learning approach. Then we also looked at decision-making biases, and this is around prioritizing what gets funded and who gets funded, and in fact the international financing for violence against women and girls' work comes from bilateral donors, comes from governments. So it's public money, part of their aid packages, and just like we looked at in sexual and reproductive health, I mean, there's a part of the problem and the answer to the question of why aren't we making progress on violence against women is there's not enough money and resources put towards it. So there's very little priority, not only for gender equality, but even within the overall spectrum of gender work. Violence against women is less than 1% of according to some studies of aid overall. But once we're looking at that small slice, who gets to decide where it's spent and how? So those of us that have worked in the UN or in international NGOs, we actually have access. Like, I met the decision makers who decide where British or US or your other European aid goes in terms of violence against women. And so, that privileged access is, it's a very small room where decisions are made. So it leaves out the folks that actually may know more or have a better understanding of the problem in their own context. I think it's quite presumptuous for international experts to make decisions about local contexts where violence has its own nuances, and the women's groups or the community-based groups and activists that are working on the issue are much more informed, but they're not in that room deciding how money is spent. Okay. So two more. The financing biases, I think, this is key to the work of UNU at the moment, and looking at the structures of financing for global health issues. And for violence against women, I think it's no different that because the aid flows coming from governments usually are framed by short-term projects that have deliverables that are priorities of that aid agency, which in some and oftentimes reflect election cycles and the national politics of their government. They need to expend big sums of money in short time frames, and it's not the local NGOs or women's movements that are ready to absorb and deliver that. It's actually international consultancy firms and multilaterals that get the biggest cut of all money going to violence against women, and then it sort of trickles down finally to local NGOs and to social movements and activists, which are getting more and more marginalized and cut out of the whole thing. So the way that the financing systems are set up is, going to high-profile wins that, the DFIDs and the USAs can get publicity around, but they're short-term and their results aren't necessarily sustainable or, part of a longer-term movement to address the core drivers of violence. The second, or the last one here about coordination, this is not, it's a little bit different, but I just put it here because, again, it's part of the work of UNU, looking at who are the actors that really need to deliver prevention and response and services to women at the local level, and how do they work together? What does a comprehensive response look like? So it, it involves police, it involves healthcare services, providers, legal services, but on the prevention side also education, those that set and drive social and gender norms. So these structures, the ways that governments are set up, the architecture of government has disincentives to work across horizontally. So the Ministry of Health has a lot of difficulty at the local level working with the Ministry of Justice and the Ministry of Health to have one comprehensive response and prevention plan where they share the costs. So this coordination constraint is, again, something I think we can talk about more and that UNU here is working on. So in terms of the technical challenges, we broke them up across the project cycle, so you can see different challenges in terms of planning or project formulation, during implementation, and then evaluation, and then using that evaluation data. So I'll get into these a little bit more. So during the design phase and sort of what I was talking about in terms of the knowledge biases and how we define violence and apply evidence, I think what I've seen and what we're trying to push back against is this kind of evidence obsession of the international development field, where driven a lot by donors, but there is, as I said, a few models that seem to show promise or that have been effective in certain places. So a women's empowerment curricula with working with local leaders, with services to survivors of HIV and sexual violence has worked in South Africa. But will that work in East Malaysia is another question. But these models have been, they've been reduced to like the thing that works and the thing that gets funded. So there's just all these derivative projects that are generated, working with couples and working with men as one, working with women's empowerment combined with services. These models aren't nuanced enough, and combined with local knowledge and experience. And so the danger is that you get this what is called evidence-driven and prioritized by the donors as evidence-driven, which is a cut and paste from somewhere else, plopped into your country. So defining what we mean by evidence, what we mean by violence. Violence is something that can be defined medically, that we do have terms for within the UN that we use, like in the prevalence surveys, but that's very different than how it plays out in people's lives and how it differs across contexts. The other problem with in the design process is that we're looking at what are long-term social change agendas in 2 or 3 year project cycles. Designing a project with an end in a few years gives you a different set of priorities and results than if you're trying to change social norms over a long time. I think there's a lot of issues around applying theory, for violence against women, especially its feminist or gender empowered theories. Oftentimes program designers or people that are implementing projects don't have access to understanding how to apply theory. They don't, they're not academics, they're practitioners. And so I think it's just not done often. During implementation, of course there's capacity issues, and so do people have the technical skills to do the things that their project is aiming to do? We talked a little bit about coordination and just amongst decision makers and the actors at the local level. But there's also this critical issue about ownership of the local community. So, was the project designed with an external model and external expertise, or was it combined in parallel with the experiential and practice-based learning of the community and their own priorities, driven by what are the main types of violence that are prioritized by that community, and what are the strengths and possibilities for change. I think also we haven't paid enough attention to the backlash to gender work within the UN, and how gender and violence against women projects can be just easily dismissed and stopped by predominantly male leadership, be it local leaders or within different ranks of the government, and by groups that are outside of the government that just are opposed to the agenda of change, which are required by violence against women work. So the issue is that you can't just work on you can't just work on the technical. You can't just give technical fixes to change the violence against women field and to make progress in the long term. The result of our analysis is, of course, the same as what feminists have been saying. You need to work at a structural level. You need to change power structures and systems, and address the other technical issues at the same time. We recognized as a new NGO that not everyone can do everything, and that we as one group couldn't prioritize, but that led us more to think about building solidarity with others that may be working in the policy realm, to look at how we can influence donors through our own access and advocacy, to expand the project cycle, to look at funding social movements and not just big international consultancy firms and so forth. So there's lots to do, but I think the problem is that too often we only stay focused on the technical. And this is part of our analysis to show how the different levels interact in our relational, so that, as I talked about, these knowledge biases which limit our definitions of violence and evidence, and thus what prevention looks like, are then related to the technical approaches to prevention that predominate over gender empowerment, or feminist approaches within the field, and that gives us narrow change objectives within projects, this derivative project design, and the lack of theory and practice-based learning. And then thus then the technical, the evaluation of all of that just spills back to the reinforce the structural levels. So in terms of ways forward, as I said, there's a lot to do, and there's not one simple answer. But part of it is to look at these financing biases and the way that money is actually been steered away from local civil society groups and women's movements. We know that that ending violence against women is a long-term agenda. It requires solidarity across different social justice groups and NGOs working on the ground, and they need support. And so working to for us, sort of outside of the NGO world, or the local NGO world, for us to advocate for financing for women's movements and local activism is quite important. To address the biases in knowledge, and to go beyond just these strict definitions of what is evidence-based or what works, elevating practice-based knowledge, so trying to value experiential learning that happens within civil society groups and amongst practitioners that have been doing this work, for 20 or 30 years. Their experience is quite valuable. So somehow trying to give it the same value as a an RCT or a rigorously evaluated project, and using both in design of future interventions. expanding the partnerships and actors involved. Again, I think this has to do with the project that UNU is working on, and trying to see that violence against women is not just a standalone issue, but it's part and parcel of a larger social development agenda and social justice agenda, and that ending, prevention, as all of you public health practitioners know, of course, that an ounce of prevention is a pound of cure, and the same for violence against women. I think that the investment in preventing violence will drive outcomes across not only the SDGs, but across the agendas of governments and different ministries. So improving health, improving education, improving livelihoods, and so on. And we're starting to see that more evidence and proof of that. And finally, just some take-home messages. We can't get stuck in this trap of deriving our only interventions that are funded from a small set of rigorously evaluated, the evidence base that we have. So we need to continue to support innovation. Along with using evidence. So innovate, don't just replicate. Practice and design, good practice and design of future interventions is informed by diverse types of knowledge, and we need to redress these biases in knowledge that affect the way we frame violence and its prevention, and learn from the practitioners on the ground. So prevention means not just the technical fix, but it's looking at, the politics, the power. What I mean by that is it means that how power is distributed in societies. So changing behaviors and structures is the way forward. It's not just a little project for 2 or 4 years. And again, this is what the feminist has been saying all along. Interventions must be grounded in evidence as well as local realities. I think I've hammered that point home a little bit. And to invest in local women's organizations and movements is critical. So that is it.
Thank you very much. Thank you, James. I'm just going to talk from here. Maybe I'll just start. Well, first of all, thank you very much for a very interesting presentation about this, the field of violence against women, and the relevance for global health more generally. I just want to ask if anyone online has any questions.
Not at the moment.
Okay, then if not, I'm going to step away from the mic because this is a bit awkward. Okay, so can I ask if anyone wants to? Yes. Okay, I've got a couple of questions already. Go ahead, Sindhu.
One of the questions I have is that the kind of violence women face depends on, intersectional location of that woman. So, my experiences with women from Dalit communities in India, and the standard solutions of going to police or, seeking judicial kind of remedies are a no-no with communities that have experienced bad experiences with the social justice system of the country because they are marginalized as a community. So what's your, I don't know enough about what's happening in terms of prevention from that perspective. Could you tell me about, specific realities of, say, women from indigenous communities, women from other marginalized groups, how the prevention as well as remedies for them may be different?
Right. Well, I think like I'm sure like sexual reproductive health, and I think you mentioned this a little bit. There are some efforts looking at, or there's let's say initiatives that I would say are intersectional in looking at race, class, caste, and other forms of modifiers of inequality, along with gender that have made interesting progress, and I think it is the only way forward at the local level. Not, violence doesn't happen in a vacuum, right? It's not just a thing that's out there. It happens as part of people's lives, in our complicated lives, and our lives play out because of, our identities. And so, the way that those try to unpack is usually using this power analysis. So understanding power and how race and gender and class affect that, how different forms of identity, and that helps build solidarity across differences. So there's lots of examples of people that do that in women's movements and social justice movements. But then the intersection with, or the interfacing with the criminal justice system is another hot button topic. I mean, it's something that I would put under that internal field area of contention. Of course we need strong laws and policies, and we need justice systems that work, but the reality is they don't work for women in most places. Even in the countries in North America and Europe, they're not adequate. So there's a strong movement for formal justice and service provision to survivors, and there are those that advocate, that that's the way forward because it's too big of a problem to fix the formal justice system. Although, of course, the UN does lots of work on training police and training judges, and I think all of it needs to happen simultaneously. But I do think there's more attention. We do need to look at formal justice systems more systematically from the international perspective. I'm sure are familiar with a lot of those initiatives in South Asia, where there's always been ways to deal with violence within the community when it's brought forward. And we may not agree with all of those traditional justice systems, but there's adaptations of working with formal and informal justice systems that I think are interesting.
Right, I think Claudia had one first.
Thank you, Jane. It was a really insightful presentation. I have just one question that the answer may not be easy, but so it was very interesting the way that you present the biases in terms of knowledge and methods and decision making. I understand that we want more pluralism of voices and approaches and methods, but in which ways do you think that these biases are hindering the progress in the field? For example, if you think in terms of methodological biases, and is the biases towards more quantitative approaches and indicators, that's desirable because that's part of SDG framework for monitoring. So it enables different approaches to have some coherence in terms of what they're measuring in terms of violence against women. So in which ways these biases can be also positive, and if you think that these biases are contributing for the slow progress in terms of achieving gender equality.
Right. Well, look, I'm not against evidence. I'm not against the public health approach of understanding a problem, but I just think it needs to be balanced with, for this particular problem, it needs to be balanced with other kinds of knowledge, and I think that the one that is most readily able to be tapped into is practice-based learning. And so, the two of the issues that I think I have with, or what's happened in the field, is that, first, there wasn't enough evidence. And if you ask, the colleagues that started the prevalence surveys of the WHO, they were said that the men in government didn't believe it was a problem. They didn't think that, it's either, it's part of our culture or it's not, or we just don't know, it's not a problem. So then they went out, and now there's prevalence data from around the world. I mean, there's a lot that survey has been replicated countless times. So now we have evidence. movements. And now, but then it's become technocratic. A lot of the work, is this is what I was trying to convey. It remains in that technical domain, and so we think we can just fix it with technical fixes. Whereas actually, as somebody said at the beginning, it's driven by patriarchy. I mean, that whole ecosystem has geopolitics behind it, has neoliberal economic policies behind it. It's driven by power systems that need to be overturned to end violence against women. And so you can't just give little technical fixes. So it's a fine balance. I do believe that we need more evaluation. We need to know what works. We need to know when we're making progress. We need, data. But we can't just hide in that realm of the technical without facing the real truth that there are structural changes that are needed. So.
Yes. Oh, sorry. Shang first.
Thanks, James. My question is, I think you mentioned about their promising intervention contribute towards this gender-based violence. So my question is that for all these promising intervention or successful intervention, is there any research evidence show that how sustainable is this intervention, especially when external funding is no longer available? And if there is some research evidence show that this project is sustainable within the community itself, what are the contributing factors contribute to the sustainability of the project?
Right. We're starting to get more longitudinal evaluation data on prevention interventions. So one of the most famous ones is it's a project from Uganda called SASA, and it's been replicated in countless countries now, lots of countries in Africa, but also here in Asia. And it's a complicated project. I mean, it requires community mobilization. It requires male advocates going out to speak to other men. It requires building trust and partnership. It has this power analysis that I was talking about. It uses power as an opening to open conversations around different forms of identity and also privilege and marginalization. And then it has very concrete things like a manual, a curriculum to happen in small group educational settings. And this project has been, I think they're still showing effects after 10 years. It's ongoing. But the problem is you have to remain, there has to be some fidelity to the overall model. You can't just pull out the manual and do it without doing the other stuff. And I think that's what's happening too often. So I don't think that short-term interventions are the way forward. I don't think the workshops for men, which do so, there have been evaluations that show that they increase gender equitable attitudes for men, and they may decrease violence within the duration of the project. I don't think those can happen and be sustained. And that's not going to be sustainable in isolation. You're not going to just have a group of 50 men, in a city or a town that goes to a workshop once a month. That's going to change the overall prevalence of violence in that community. But yeah, I guess just to get back to your point, we are, the evidence is showing we do have more longer term evaluation work that's happening, and it's nuanced to show which components are driving success, what's necessary as core components of the interventions, because all interventions are multi-component. So we're getting a lot more data on what's working and why. But to me, it's the thing is they need to be comprehensive.
Thanks, James, for the nice presentation. Actually, you put in very details like the structural, technical, and all those methodological things. I quite agree with you. But as you said, the violence against women is preventable. This is not a question. It's just some of my comment are, you can say, some of the things from my own practical experience while working on an intervention to end violence against women, actually to be there on the battlefield. So the thing is that all these things, as you say that the structural, sometimes are affecting the technical, and is vice versa. So for me, the most important thing and the successful implementation for this is a political commitment. If there's no any political commitment, all of these things probably will not be or will never be successful for all those intended outcomes. I think the very first question when you came to ask, what's the reason behind it, somebody from there, I don't know who said the patriarchy. So it's okay. So it's the system, it's the the structure of the society or those countries in which this is prevalent. All those patriarchy is being supported by all those political leaders, all those governments that are ruling that country, most importantly the military, and all those so-called religious leaders. So all these are being supported because those are the people who are the parliament who pass legislation and who don't allow you to work these end violence against women preventions in the practical. I was there and I got my life threats, but I was there for the 5 years fighting everybody from all those. So you are not getting support from any things from the government to this. This is the political government of that particular country, and then something should be done from the international community also. So all those international community are not binding more force on these countries to enhance and to ensure all this violence against women. And because there are always like all those, the so-called superpowers, our powers, you have to call other three things. Either you have to save your trade, selling of the weapons, if you can't use your trade deals. You have got your political gains because that country is supporting your political agenda, and then you have got all those investment and market opportunities, you don't want to lose your market. So there should be a political commitment from the international community, binding on those countries where this violence against women is going on. And the second, all the ruling elites of their country, they should not support all those patriarchy. In structural, pure sociological, yes, patriarchy has got the definition, but I'm saying that patriarchy is the mindset also. It's also there, from all those who are the legislators to the judiciary as well. So this is some of my comments.
I agree.
Do you want to add to that, or is it?
It's picking up on the issue of transformation, perhaps, and we're looking at that structurally, but if I could just, how much are you looking at transformation within the individual survivors themselves? And I mention this because when I worked at the International Criminal Court, I ran a study to assess harm that occurred for women and girls in areas of conflict. And what they identified was not just necessarily their ability to obtain health services or access to trauma-based counseling, but for them to be able to reconcile with their communities or with those who harmed them. And I'm just wondering, in terms of the ability for survivors to repair, how much are you considering that in terms of what you're looking at for models, and what does that mean for sustainability and transformation within communities?
Yeah, well, that just reminds me, I think I've maybe presented prevention as a little bit too much of a standalone field. It's not. I mean, prevention and response is a spectrum, and they actually are very interdependent. And these models that show success in prevention are grounded in working with survivors and responses, and especially at the community level. And in my opinion, it's not that I'm making models or applying, but in my opinion, the best people to inform what prevention looks like or what those community-based responses are survivors themselves. And I think survivor-centered is what they call the survivor-centered design is prevalent, but more so amongst community-based organizations and local NGOs than the technical people at the top at the UN and the bilaterals. But it's certainly, I think, generally accepted that you can't do one without the other, and any prevention intervention is going to drive demand or potentially drives demand, and we've seen it happen. For more response and services. So yeah, I agree with your sentiment entirely.
What opportunities are there? I noticed you mentioned it had come up a few times. What opportunities are there to influence the funding community for this work? The Spotlight initiative we know has been launched 2 years ago, and it's not clear what's happening with that.
Yeah, I mean, I think I feel really that the funding for women's movements and NGOs is critical, and I think for the international community to advocate to donors, to allow for more money to go to local NGOs is quite important. The other issues around, there are donors groups for lots of public health issues, and there's the beginnings of donors groups for gender-based violence. There's not a formal one as far as I know, but DFID and the Swedes and the others, they meet and discuss what the priorities are, and I think there's ability to influence at that level, to do some of these things. If I had their ear, I would say, the long-term change requires women, funding women's movements, but I would also get at this point around not being obsessed with replicating these derivative models. Like, be careful when you do that, because a lot of funding was earmarked to evidence-based models, and so there was no innovation. It was just like, oh, well, we're going to take SASA and we're going to put it here. And I would advocate for more, thinking about funding more innovation, this issue of practice-based learning, like somehow getting donors to value other kinds of evaluation evidence rather than quantitative, quasi-experimental, or the stories that people tell are actually quite important. We need to elevate that to the same level sometimes. And those are a couple of things I would say to that donor group.
You just need to get into that room.
Yeah.
Get there. Any other thoughts or comments, contributions? Yes, absolutely.
Thank you. Your talk has raised a lot of questions for me. So I'm hoping to be a little bit coherent, because a couple of things. You touched upon thousands of research proposals being submitted to this conference that you spoke about. How much of that research is telling us something new, and how much of that research is telling us things that you already know? And I think this speaks to sort of your need for more innovation around this area. My other question is around, you also spoke about practice-based learning. Practice-based learning for who? To do what? Why? Because I think when you spoke about some of the structural changes and technical interventions, practice-based learning can happen in many different institutions and at many different levels. So can you sort of unpack that a little bit and talk about what you mean by that and how that can sort of help move the agenda forward? And my final sort of question is what's the end outcome, or what is it that prevention strategies are aiming to achieve? Because if it's to prevent violence, are there sort of more fundamental questions we need to be asking about, well, what kind of society do you want to live in? What kind of institutions do you want to create? What kind of relationships do you want to have? And our prevention strategy sort of asking those big questions that stimulate sort of more deeper questions within sort of technical agencies, within communities, and across sectors.
Okay. Well, to answer the last question first, I mean, I do think like a technocratic approach to ending violence, if your end is ending violence and you don't ask those bigger questions, you've missed the mark. I mean, I think that a world without violence is, it's defined by peace in the broadest sense. So ending violence against women and girls, comes hand in hand with a much more just and peaceful society. And what does it take to get there, and how does ending violence a part of that? I do think that ending violence is a constituent part of gender equality, and gender equality is a constituent part of social justice and peace. And so it's a good question to ask, and it helps you set the frame of what you're trying to do and change. The second question, part of your question, or sorry, I'll go to the first one. The evidence, or what is this research? I think that a lot of it is telling us what we already know and reinforcing that, and there's lots of nuances. I mean, just like any other academic discipline and that has practical applications in international development or public health, there's not a magic sort of connection between research and practice, or there's not anything of magic. There's often very little. I do think that violence against women field has a good relationship amongst academic research. Researchers are practitioners in many cases, and practitioners listen to researchers. I do know this field more than others, so maybe I'm biased, but I do think there's still no control over how, who gets funded for what postdoc work and what they, there's all those other things that are going on that drive research agendas. And I do think, there's a lot of stuff that is just, it's nuanced by place, so this research has been done in one country, now it's being done somewhere else, or it's very nuanced about what it's trying to understand. But I think we know a lot more about drivers of violence, and that's getting reinforced. Like there are some, to me, what are emerging as kind of universal that do have nuances, but the large scale household surveys that have given us one bit of evidence is being reinforced by a lot of qualitative work and life histories that people are digging into from both survivors and perpetrators of violence. So I do see the qualitative validating what has emerged as analysis from the quantitative household surveys, both the WHO and then other ones. I'm sorry, what was the middle one? Oh, practice-based learning. What is practical? Yeah, my experience of it is very much of an NGO trying to learn from itself. And what I mean by that is like somebody that's been doing work on violence against women, or an institution that's been doing work on violence against women in a community where violence is quite prevalent and gender norms are very strict and women are discriminated against in many ways. Like their successes mean a lot, and the stories are capturing the stories of what they've learned from that 20 years and why their successes have happened is quite important. Just as important as what a quick evaluation or a RCT is going to tell you, right? So the practice-based learning to me is, what does that 20 years of implementation, what does that tell us, and how can we apply that in the future as we're continuing to fund or continuing to design, and how do we combine different kinds of knowledge? Like, what does the evaluation, tell us that the practice-based learning? So it's not complicated. It's just having a process of unpacking those stories, of asking the right question to experienced practitioners, to people, NGOs. And then this knowledge bias, like people don't value their own experience as much as like what some survey tells them sometimes. And that I think has to change. But practice-based knowledge to me is not any more complicated than that. Just having a process to ask the right questions to tease out experiential learning.
Okay. I think we might wrap up now. Can I have one more answer? Thank you very much. So just a very quick recap, but let's just recap, and I'm sure people are ready for Makan as well. So Sundre started us off with SRHR, integrating SRHR within UHC, and what is the evidence, what do we know about that? Universal health coverage is currently the big thing in global health, and if we're talking about gender and reducing gender disparities in health, sexual and reproductive health and rights are clearly a very critical, place to start and make sure we're doing right. But yet we are in a situation where 2/3 of the financing for SRHR is coming from users themselves at the time of need, really at the point of service, of accessing services. So clearly there's something we're doing wrong, and the evidence base is actually very limited. In this space. So Sundri has highlighted the need for more evidence on beyond the need for integrating SRHR. I think we have made that case over and over again, but evidence on actually how do you do that? What are the mechanisms through which you do that? What have we learned from actually trying to do that in different settings? So we hopefully will be able to move that evidence base forward, not just us, but I mean as a field, and really be able to support decision makers to be more strategic in how they do that. We then moved to sort of violence against women and girls, which is obviously one of the worst manifestations of gender inequality in society. Learning from how that field has grown and evolved. And James highlighted the need there to broaden what we mean by evidence, what we mean by evidence-based approaches, which is, for someone in research, it is quite it is provocative, but a really important push to remind us that actually by focusing on this, how a very narrow set of evidence and knowledge and pushing for evidence-based policy and programming, we might actually be crowding out innovation and more locally relevant and adapted interventions. So and also reminding us to build on practice-based learning, on knowledge from local organizations, and really supporting and investing in these organizations who are the ones doing all the real work out there. So a reminder to all of us to technical fixes are important, and we definitely need those, but also that we're talking about gender and health, and so we do need to go up to the structural and to actual transformation and be open, even though we are public health people, many of us, to actually deal and be more comfortable to deal with power and actually take on that battle. So I will just wrap up there. This is the first of a series of gender and health seminars, so we hope to welcome you again for the next one. We had some colleagues online as well. Please feel free to invite others to join us. We will keep you posted through the mailing list. And I will invite you to lunch, unless my director would like to say some final words. No? Okay, but thank you all very much for coming, and again, lunch is just next door.